You got it. Whatever works. Lean right in. And I'm going to bring the table down. And the reason why we use this table is to get an accurate leg length analysis. Put your hands right by your side, please, sir. Thank you. Make yourself comfortable. All right. So what we're going to do first is look at the leg length and see if there's an imbalance. And you can zero in on this if you want to right here. And there is a slight imbalance. Can you see that? All right, there's about a 1/2 inch leg length imbalance. So now what we're going to do is test to see if anything we do causes the legs to balance, and that does. So we could make a correction on the knee. It's up to the doctor to decide. And we're just putting some gentle stresses and put your right hand on your low back, having the person activate. Now look at that. You see that?
I do.
How tight that gets. Both hands on your low back. So there's something we could do to the low back. Good. Down by your side. Right hand up by your head. Down by your side. Turn your face to the right. Shrug your shoulders. Turn back to the center. Lift your head up. And tuck your chin. Look down. Okay. Up to you. You want me to make a correction or not?
Yeah, go for it, bud.
All right. We're going to go for it now. We're going to make some corrections, and the corrections are going to get made with this activator instrument, which introduces a high-speed, low-force impulse into a joint. You barely see my finger move. The correction is delivered at 1/300th of a second, which is very fast, and it's a measured force depending on where we're adjusting. 12 to 18 pounds of pressure at 1/300th of a second. So very fast, but very gentle. And we check to see if that made the correction, and it did. So now we move further up. And we check again to see if anything causes the body to be out of balance. So now we're going to work on the right pelvis, make a couple of corrections. Very gentle. You don't hear the patient screaming, which is good. Right hand on your low back. And we see that the correction is made. Both hands on your low back. And down by your side, we're going to make a correction in the lower lumbar area. Both hands on your low back again. And we get a pre and post test. So we check to see if anything tightens the body. And then we make the correction and we check to see if the legs are balanced. Right hand up by your head. So it's a full body check all the way up, down by your side. And we get to pre and post check to make sure that we got done what needs to get done. Right hand up by your head again. So we'll check to see if it balanced, and it did. Both hands up by your head. And we go all the way up the body, down by your side. Turn your face to the right. Shrug your shoulders. Relax. Right arm tight against your body. Ooh, okay. Well, something. So the beauty of this is that we're not basing it on the patient's complaint. We're certainly going to focus on the area of complaint, but we want something that's a little bit more objective, because it's a way of kind of understanding what's happening in the body, not based on symptomatic pain, because you could always take a medication, a painkiller, and that would block the body's sensation of pain, but the person wouldn't be any healthier. So what we're looking to do here is to create balance in the body so that it's actually going to be healthier. The person's going to be healthier over time as we create better balance, because balance is good for the body. And that's